As with any government shutdown, both political parties are casting the blame on each other. The Democrats claim the GOP is responsible for rising healthcare costs, while Republicans say the DNC is holding the government hostage with a, quote, far-left wish list. One of those proposals includes funding for the health care of undocumented immigrants. But do the Democrats really want to provide every undocumented immigrant free health care? Let's verify.
The official White House website now has a government shutdown clock on it, titled "Democrats Have Shut Down the Government." Several GOP lawmakers are echoing this sentiment, claiming that Democrats are making outrageous, far-left requests that, quote, Americans don't agree with. One of those requests is allegedly free health care for undocumented immigrants. But are Democrats proposing free health care for undocumented immigrants? We verify. Our sources are the whitehouse.gov, the Senate Democratic Caucus, U.S. Citizenship and Immigration Services, and the National Immigration Law Center. Here's what we found. According to a memorandum released by the White House, the Democrats are demanding that some of the reforms signed into law is the Working Families Tax Cut Act be repealed. The White House says this would result in the federal government spending nearly $200 billion on health care for illegal immigrants and non-citizens over the next decade. However, according to the Democrats' proposed Senate appropriations bill, it would only restore health care coverage for, quote, lawfully present immigrants, not for immigrants living in the U.S. illegally. In fact, there are federal laws that prohibit using federal funds to provide health care to undocumented immigrants, with one significant exception: emergency care. What the Democrats' bill does propose is extending the ACA enhanced subsidies and rolling back Medicaid cuts that were part of President Trump's One Big Beautiful Bill. The biggest question here is the term, quote, lawfully present. This term refers to non-citizens who have qualified immigration status that makes them eligible for Medicaid or the Children's Health Insurance Program. This includes lawful permanent residents, refugees, and those granted asylum. The One Big Beautiful Bill changed coverage for non-citizens by capping the amount of emergency Medicaid funds that providers such as hospitals receive and reimbursement for care given to immigrants. It also changed the criteria for Medicaid enrollment to exclude those granted asylum and parolees. Parole is a legal permission granted to non-citizens that allow them to temporarily live in the U.S. for urgent humanitarian or significant public benefit reasons. About 2.8 million people were granted parole during the Biden administration. Republicans argue that parolees are in the country illegally and should not be covered under the Democrats' extension of Medicaid. So, we can confirm that Democrats are not proposing free health care for undocumented immigrants. The argument is whether parolees should be included in the term lawfully present individuals, which is not clearly defined in immigration law.
If you have something you want us to verify, text us at 256-382-2692.